Why does early diagnosis of dementia matter? Let's dive into it. Early diagnosis is crucial because it allows for timely intervention, which can significantly improve the quality of life for those affected. It also provides an opportunity for patients and their families to plan for the future, make informed decisions, and access the necessary support and resources. Dementia is a brain disorder that affects memory, thinking, and daily activities. It is not a single disease, but a general term that encompasses various conditions, including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type of dementia has its own unique characteristics and progression patterns. Knowing its types and diagnosis methods can help manage it effectively. Understanding the specific type of dementia a person has is essential for developing an appropriate treatment plan. Different types of dementia may respond differently to various treatments, so accurate diagnosis is key to effective management. First, doctors start with a medical history and interview. This initial step is critical as it helps the doctor understand the patient's background, including any previous medical conditions, lifestyle factors, and family history of dementia or other neurological disorders. They ask about health history, family history, medications, and when symptoms began. This information helps the doctor identify any potential risk factors and determine if there are any other underlying conditions that could be contributing to the symptoms. This helps rule out other causes like side effects from medications. Sometimes symptoms that resemble dementia can be caused by medication interactions or side effects, so it's important to consider all possible factors. Next, neuropsychological tests assess memory, attention, language, and problem-solving skills. These tests are designed to evaluate the cognitive functions that are often affected by dementia and can provide valuable insights into the severity and progression of the condition. Tests like the MMSE check cognitive functions to see if there's been a decline. The Mini Mental State Examination, MMSE, is a commonly used tool that helps doctors assess cognitive impairment and track changes over time. Physical and blood tests come next. These tests are important for identifying any other medical conditions that could be causing or contributing to the symptoms. These rule out other conditions like vitamin deficiencies or thyroid problems that could mimic dementia symptoms. For example, a deficiency in vitamin B12 or an underactive thyroid can cause cognitive symptoms similar to those seen in dementia. Brain imaging like MRI or CT scans shows structural changes. These imaging techniques can reveal abnormalities in the brain structure such as shrinkage or damage, which are often associated with different types of dementia. PET scans can reveal brain activity, helping identify specific types of dementia like Alzheimer's. Positron emission tomography (PET) scans can show how the brain is functioning and highlight areas with reduced activity, which can be indicative of certain types of dementia. In some cases, genetic tests check for hereditary factors. Genetic testing can identify specific gene mutations that are associated with an increased risk of developing certain types of dementia, particularly early onset Alzheimer's disease. This is especially useful for early onset Alzheimer's. Knowing whether a person has a genetic predisposition can help in planning and managing the condition more effectively. Finally, sometimes doctors use spinal fluid tests to measure protein levels associated with Alzheimer's. These tests can detect abnormal levels of certain proteins, such as beta amyloid and tau, which are linked to Alzheimer's disease. Early and accurate diagnosis is key. It allows for better management of the condition and can help slow the progression of symptoms through appropriate treatments and interventions. It helps in planning the right care and managing symptoms better. With an early diagnosis, patients and their families can access support services, make lifestyle changes, and explore treatment options that can improve their quality of life. If you notice signs, consult a specialist early for the best support. Early consultation with a healthcare professional can lead to a more accurate diagnosis and a comprehensive care plan tailored to the individual's needs.